right. Hello, everyone. Welcome to the next episode of the Primetime Mindset Podcast. This podcast is where we dive into the habits, mindset, and behind-the-scenes stories that fuel success in fitness, business, and life. I'm your host, Jarrett. And before we jump in, I want to share what this show is all about. The Primetime Mindset Podcast isn't just for athletes. It's for anyone showing up every day to be better than they were yesterday. It's about preparation, pressure, progress, and how we push through the moments that matter the most. Today's guest, Dr. Richard Harris, is a board-certified internal medicine physician and pharmacist, and is kind enough today to share his journey and, what he's doing to change lives in the health and wellness space. So, Dr. Harris, welcome to the podcast.
I appreciate you having me on, Jerry, and I always love talking about stuff that I'm very passionate about.
Awesome. So let's just jump in. You have obviously a lot of things that you are a part of and that you're doing. As we talked about internal medicine, pharmacist. You're part of a pharmacy. You have your own internal medicine practice. You're chief medical officer or chief medical director for other different locations. Give us a little bit about your background. You also have an MBA. How did you end up where you're at? And just give us a little bit of that. We can go from there.
So as a kid, I was always interested in math and science. And then I read Gifted Hands by Ben Carson. And that was what really led me to wanting to become a physician. Kind of strayed away from that in high school and early in college. But my first year in pharmacy school, I realized I wanted to be a doctor and finished pharmacy school and then went and did medical school, internal medicine. And I've always been more on the holistic side. Like in pharmacy school, we learned a lot about different supplementation. And I really fell in love with that, especially regarding like exercise performance. That was the first area that I really started diving into the literature, because at the time I was heavy in the gym. I was in a powerlifting club in college and, trying to figure that space out. And then as I got out in practice, I realized that I didn't know anything about business. I didn't know how I got paid, right? And that's kind of a scary thought. And so I like to structure learn before I unstructure learn. And that's why I decided to do the MBA. I thought I was going to do hospital or healthcare administration, but I kind of got the entrepreneurial bug in the MBA program. And that's when I started my first clinic, started doing clinical consulting for supplement companies and health tech companies. And then in 2021, we started Nimbus, me and my friend Joby, who owned a compounding pharmacy. And then at the same time, I was approached to be the CMO for a other farm tech startup that makes software for pharmacies to do prescriptive authority and do medical billing through that. So that's really what led me to where I am today. And it's really cool because I get to use my pharmacy degree, my medical degree, and the MBA in what I do.
Very interesting. I have a friend of mine that is a OBGYN up in Atlanta. And that was one of the things he mentioned as well about the business side. We get out, we get we're a part of a practice. We start our own practice, and that's just one thing. Hey, nobody told us how we're supposed to bill patients, and how do we make sure we're the revenue's coming in, and so on and so forth. So it's a very you're not the first doctor to say that to me. It's very interesting. So what are the services? You touched on this a little bit, but what are the services that maybe your practice focuses on, Nimbus or the pharmacy focuses on? And do they blend over together, or are they kind of separated and kind of running their own channels?
Yeah, they sort of blend over. I brought a lot of what I learned doing first side of functional medicine practice, and really learned a lot about the business of running your own practice. Realized that I didn't particularly like functional medicine, mostly because it orders a lot of tests and the data may or may not be clinically relevant. And I started
when you say functional medicine for the rest of us, what does that kind of entail as opposed to just what we would say typical medicine practice?
Yeah, so functional medicine bills itself as getting down to like the root cause of what causes a disease. And one of the mottos is test, don't guess, right? And so you end up ordering all these in-depth panels. Some of these panels I would be ordering like $1,000, $1,500 on patients. And it really didn't tell me anything different than what a good history, physical, and some basic blood work would tell me. Not basic, I would do a little bit more in-depth blood work. And so I started narrowing down on like what was working for people and what I really wanted to do. And I realized that I didn't really want to treat everything. I was treating a lot of stomach disorders and GI issues, and I didn't really like that. And so I focused more on prevention because I've always been someone who's been very focused on risk and risk mitigation. And so I started looking at, well, how do we prevent disease? Like, what are the biomarkers and the biometrics that show that someone's at a higher risk for developing a disease, right? Prevention is worth a pound of cure, right? Ounce of prevention worth a pound of cure. So that's what I really started focusing on. And I call them like health risk assessments. Like, what are you at risk for? What can you do about it to lower that risk? So that's a major component of what I do in my practice. And then I do metabolic health. So diabetes, hypertension, high blood pressure, weight management, fatty liver disease, because they're all pretty similar in how you treat those things and the root cause of those things. And I enjoy like getting people off blood pressure meds and diabetes medications. And then Nimbus focuses on a couple other things. We have a genetic test for hair restoration. So then we custom compound a topical solution for that. We do the weight management. So we do all the GLPs. We do hormones for men and women. And then we do peptides, which is our newest program. So a lot of like BPC 157, TB 500, NAD, glutathione, sermorelin, CJC, dihexa. Those are the main ones that we're doing right now.
Awesome. What are some of those? Can you speak to maybe 2 or 3 biomarkers that you're finding, or I don't want to say you can either think of most prevalent or some of the ones that are the kind of the most important ones that you're say, hey, let's check these. If I'm going to check any 3, I'm going to check these 3 first.
So these are often not done in clinical practice, but fasting insulin. I think that's super, super important because it's the canary in the coal mine. So what will happen when your blood sugars start to go up is you'll secrete more insulin. And we have some studies showing that once that insulin level gets above 10, that's where a risk starts to happen. But your blood sugars can be normal. Your A1C can be normal, but your fasting insulin can be high. I've seen that numerous times when people have fasting insulin of 30s or 40s, which is very high, but their blood sugars are completely normal. And that lets me know that, hey, if you continue on the path that you're on, you are high risk for developing diabetes or prediabetes in the future. So that way that person can intervene early. And we know that even prediabetes, which is very common, imparts the same level of risk for like cardiovascular disease, cancer, Alzheimer's. It's just not as high as diabetes, but it has the same risk profile. So that's a big one. So always get your insulin checked too if you have, risk factors, and especially if people are overweight, obese. That's a key indicator for me to check that. I always check apolipoprotein B. So there's a lot of hoopla online about cholesterol and LDL-C, and a lot of people say that LDL-C is not causal for cardiovascular disease. It is. The issue is it's a area under the curve problem, meaning it's how high is your exposure over how long of the time period. So just because your LDL-C is normal when you have a heart attack doesn't mean that it wasn't high in the past, right? And you had high exposure for a long period of time, because these things can fluctuate. So ApoB, though, is the protein that actually carries the other lipids, and it's the best correlated lab marker as far as the lipids go for cardiovascular disease. So that's the one that I care about the most. And then the third one would be a biometric. So most of the time when you go to clinic, they just measure your BMI, right? And BMI is okay for population studies because it's cheap and easy to measure, right? You just need someone's height and weight. But it doesn't tell you where that body fat is distributed. And so using things like the body roundness index or even a waist circumference, so your waist to height ratio, waist to hip ratio, gives you a lot more information about someone's metabolic health as far as where they're distributing their body fat. Do they have a lot of visceral fat, which we know is associated with poor health outcomes? So So those are 3 easy ones, not expensive, that can be done, and ask for them at your doctor's office when you go in for your physicals.
So now I'm going to ask, because I'm curious about my belly right now. What is a good ratio?
So waist to height ratio is like less than 0.5 is usually where we like to see. The body roundness index, which is a calculation that you can do if you know someone's waist circumference and then their height, weight, that type of information. We usually like to see that around 3. Once you get above 3, that's where some risk starts. So those are things that are easy enough to measure, and they better correlate with disease risk than just your standard BMI marker.
Very, very interesting. There's a lot of people checking that waist to height ratio now. That's a good one. Oh man, that's gonna get people in trouble.
Super powerful. And I'll send you the link, but I spent a month creating a spreadsheet that I give away for free that has all of the biomarkers, all of the biometrics that I track, what the breakpoints are, what the risks are, and then what you can do about those numbers to improve them and lower them out of the risk range.
So that's a good question. What are some of the things that you recommend? Obviously game day is focused on men's health, but men and women, and if it's different, what are some of those things? But what are a couple of lifestyle changes that you often recommend to men or women to do to help adjust these biomarkers, as opposed to just medicines or medications?
Of course, the first thing is exercise, right? I'm a huge believer in both strength training and cardio. You have to do both. You can't just do one or the other, right? You get the best benefit for longevity, for cardiovascular reduction, for body weight control when you do both aerobic and strength training. And I often hear from people, well, I don't like doing strength training, or I don't like doing cardio. I'll tell you, I can't stand cardio. Like cardio for me is just not fun. I can lift weights all day, right? My wife is the opposite. She's like a cardio bunny. She loves cardio. She'll just one time she didn't even train for a half marathon. She just did it. Right? She's just one of those types of people. Yeah. So I do cardio twice a week. I don't like it. I don't enjoy it, but I'm not a toddler, and my goal will not be achieved by doing things that I just like only. Right? Yeah. So, I force myself to do 30 minutes of HIIT cardio twice a week because it aligns with my goals. So that's the first thing. The second thing for nutrition, there's a lot, right? It can be simple, it can be very complex, and there can be a lot of interperson variability. But I think 2 big things to do with people is most people don't drink enough water. The CDC estimates that 50% of Americans don't drink enough water. How much is enough? About 3 liters for men, 2 liters for women, and titrate that to your urine being light yellow. That's pretty much the best marker there. Things can change whether you're working in the sun or you're working out, for hours. Like professional athletes, you may need to supplement some electrolytes there, but that's a good place to start. And then the second thing for nutrition, I think is the biggest bang for the buck, is fiber. So the average American eats about, I think it's 13 to 15 grams of fiber per day, which is well below the 28 grams of fiber recommended for women, 35 grams of fiber recommended for men. Fiber intake is associated with decreased risk of certain cancers like colorectal cancer, improved mental health. For every 5 grams of fiber you eat, it lowers the risk of depression by 5%. It also lowers all-cause mortality by, I think, about the same. I think it's 5 grams for 5%. So that's a very low-hanging fruit, is increased fiber. And the third one is make at least 80% of your total caloric intake minimally processed or whole foods, right? The standard American eats about 60% of their calories from ultra-processed food. And we know that a high intake of ultra-processed food, which are foods that you can't make in the kitchen. Like I can't make Doritos in the kitchen. I can't make a Snickers bar in the kitchen. That's the easiest parameter for it. Those things are associated with worse mental and physical health. So those are really simple, 3 simple things that we can do for nutrition that have a lot of bang for your buck. And then the third one would be sleep. And if you look at the data on what's more important for longevity, is it sleep rhythm. So are you going to sleep around the same time, waking up around the same time, or sleep duration? It's that making sure that we go to bed and wake up around the same time every day. So that's kind of the first thing that I'll work on people, is starting a sleep routine. Most of us have a morning routine, but most of us don't have a sleep routine that's beneficial, right? So figuring out how can we create an environment that's conducive for sleep. Those are the three big things that I'll focus on that are very easy to do with minimal disruption to people's lives.
Yeah, that sleep routine. It's funny you mentioned that. I have twins. They're older now. They're 20s. When they were really little, we their mom and I had this routine to get them to really settle down. We did it for almost a year, and this whole bath and this certain lotion, and it's just whole thing, and they would just knock right out. And now that you mentioned that brought me back to that moment, and I'm like, why don't I do that for myself? Because I have a hard time sleeping, and that's a really good one. So two things that came out of what you just said. One is the fiber, or when you talked about nutrition, how much, or do you have a ratio around what you're okay people getting from supplements as opposed to getting from raw food, knowing that can't always get all your veggies in one day, or your fiber the traditional way?
Sure. So two things there. One is intention, not perfection. That's something I tell my clients all the time. Like, I don't meet my fiber or my protein goals every single day. I try to meet them 80% of the time, right? If I'm doing that, that's going to be aligned with my goals. That's why I tell people with workouts, everything. If you hit 80% of the time you're making the mark, you're perfect, right? So you don't have to be 100%. 80% is good enough. For the fiber, like, I typically get around 50 grams of fiber a day. Now, I didn't start doing that. I gradually increased it. You don't want to just all the way increase. So like you're getting like no fiber to 50 grams. You're going to have some GI effects from that, right? You're going to have some stomach effects. But I get about 20% of mine through like ground flaxseed and like cacao powder, stuff that I add to food as opposed to whole foods. Gotcha. So in general, those things can be very helpful in people achieving their fiber goals. Psyllium husk, ground flaxseed, I love. I add it to yogurt. I add it to oatmeal when I eat those things. Cacao powder has fiber in it. And so those are simple ways that you can add more fiber. Whole grains are demonized online a lot, saying that they spike people's blood sugars. If you look at the data, whole grain intake is associated with less risk of diabetes. But it's got to be whole grains, right? So things like farro and steel cut oats and those types of minimally processed or unprocessed grains.
Okay, that makes sense. The other part, when you went through your three things, similar conversation I have with patients that come to our clinic, understanding that we focus on hormonal health and peptides and similar to you. But I tell folks, look, you got to do these three things either first or in line with improving your hormone health for you to really see benefits, and that's exercise, sleep, and nutrition. How do you then work in, when you have those conversations with people and they're doing those things, or maybe they haven't, but there's some hormone issues going on. How does that with your telehealth or with your virtual clinic and things like that? How do you work in hormonal health with them as well?
Yeah, so you have to individualize things for people, and you kind of assess where they are and what do they need support. So if someone's already started that journey, they've already started working out, improving their diet, started working on their sleep, and they come to you and, let's say their testosterone is low. In that case, I may wait and see if with those changes in 3 months or so, does it improve? And we know, for example, that when people lose weight, their testosterone goes up, right? When they start working out, their testosterone goes up. When they start sleeping better, their testosterone goes up, right? So if that person's already making those steps, then I'm going to hold off. But if I have the person who comes in and says, I can't get out of bed, I fatigue when I exercise, I want to try to exercise, but I just can't, I make it 10 minutes and I hit the wall. Right. That's the kind of person who I may start on therapy first. And even in those people, even low doses, I think a lot of, and you may see this when people come to you from other clinics, a lot of these places just bomb people with mega doses right off the bat. And unfortunately, when I worked in the hospital, I saw a guy in his 30s have a stroke because of that. One of these low T centers was giving him, I think it was 300 twice a week.
Wow.
I was like, that's an insane dose.
Yeah.
And then they didn't check any of his labs. And he came in and his hematocrit, which is a marker that we follow for testosterone, we follow hemoglobin, hematocrit, because testosterone can increase your red blood cell production. More red blood cells means the blood is thicker. This guy's numbers were undetectably high. So they had reached the level of detection of our labs, and he had a stroke because of that. And I had to tell him that, hey, this is the reason that you had a stroke. And that to me should have been preventable, right?
Yeah.
100% preventable. We don't always need to chase levels or get people to a certain target with these things. Sometimes a little bit goes a long way, especially in people who are already making lifestyle changes.
Yeah, no, it's a major conversation we have as well around, it's not just improving the level, it's improving your symptoms, right? What is going on with you is different from what's going on with this other guy. He may need a higher dose and you may need a lower dose, and you both walk away just fine, feeling better and able to do the things you want to do. So that is an insane dosage. Wow, man.
Yeah.
Okay. You mentioned the hair restoration earlier. What are some of the things you guys are doing in that space? Or, I mean, obviously I'm not looking for your patent, but what's, because we offer it here, but we it's something that we haven't done a lot of. And we do PRP and things like that. But what are some of the, you said some topical solutions and something else?
Right. So we look at it as an augment to things like PRP, laser therapy, microneedling, those types of things, even hair transplant. We have several patients who had hair transplants and they were never put on maintenance therapy and those follicles died, right? And so we had a couple who had 2 or 3 transplants and now they're stable on therapy with us. So what we did was we developed a genetic test that looks at, the area is called pharmacogenomics, and it is looking at your genes and based upon your genes, evaluating which therapies are you more or less likely to respond to. For example, minoxidil, right? One of the first treatments that came out for hair loss was a blood pressure drug. Then they noticed that people's hair was growing everywhere because it causes hair growth everywhere. And they rebranded it as Rogaine, right? And so there's a gene called SALT1A1, and SALT1A1 is the gene, it's a sulfur transferase. It activates minoxidil. So minoxidil is what we call a prodrug. So that means that the drug needs to be bioactivated by your own machinery inside your body, right? And for people who have a sluggish SALT1A1, they don't activate minoxidil as well. So these people are less likely to respond to it. So you either have to use a higher dose or you have to use something like retinoic acid, which is a vitamin A derivative, to improve the efficiency of it moving through that SALT1A1 pathway, right? So that's what we do in the genetic test. And, the orals, minoxidil, dutasteride, they do work, but there are some serious side effects. Oral minoxidil can cause some very serious side effects. Dutasteride drops DHT. That's its job. That's what it's meant to do. But then a lot of these men feel like they have low T, right? Yeah. Because you've blocked their conversion of testosterone to dihydrotestosterone, which is the more active, the more potent version. So what we did was we made the topical that people apply to their hair to help for people who didn't want to take the oral medications anymore and who wanted to see what they're most likely to work for them, because the hair regrowth game is all about time, right? The life cycle of a hair follicle is long. And so you have to be patient with the growth of hair. And so this allows for people to feel comfortable knowing that systemic absorption for many of the compounds we use is low. Topical minoxidil gets absorbed, topical finasteride gets absorbed, dutasteride probably doesn't get absorbed to a significant degree. It's a larger molecule. So that's what we do. And we've seen some very successful results with that. And we partner with clinics who are doing all those other modalities, PRP, laser therapy, as a way for patients to have maintenance therapy in between their treatments.
Awesome. So what would you say, I can come up with something on my own, I'm just talking to you here right now, but what would you say sets, your practices and your businesses and the pharmacies apart from the other ones out there, on how your customer approach, or what would you say that would be?
Nimbus is one of the rare things that our executive team are all clinicians who have significant business experience, right? So the CEO, Joby, who's a good friend of mine, has been in the compounding pharmacy game for over a decade, maybe almost close to 2 decades now.
Wow.
And he's had multiple tech companies as well. And then you have me as the CMO, who's run clinics, who's consulted with health tech companies, who's consulted for supplement companies, who has an MBA. And so now we're able to think about the entire patient experience from every single point in that experience, right? From the clinician visit to what to expect in between while you're waiting for your meds, to once your meds get there, to how to use the meds correctly, to follow up, right? So we make sure that we really connect the dots in healthcare being a vertically integrated system to where people can get everything at once. And then for the other arm of Nimbus is we work directly with the compounding pharmacy that we own. So we do have some B2B contracts as well, where we just make things for other people who are seeing patients. So that's really great. And then we have a tech arm as well. We're actually developing AI to help educate patients on what they're taking, why they're taking it, the dosages, help prescribers prescribe like seasoned clinicians who have done this for a while. And then also for connecting the dots, that risk assessment. So we can integrate with wearables and we can see your wearable data and give you, Toyota called it just-in-time manufacturing, right? We want just-in-time information, the right information to the right person at the right time. And that information is actionable. So those are the 3 things that really we're working on. And what makes us unique is it's all under the same roof.
Yeah, that, not to sound too nerdy about the tech. The one thing that it sounds like you guys have the ability to really come at the patient from all angles, right? Okay, you're taking this and this is what's happening. And we know that if this changes, we have something else for you over here. Or if this goes up or down, we can do this. And that just-in-time tech feels like a world where we're coming to, things are happening with you and your tech is putting out information to where things are already getting ordered, right? You just have to check the box. Yeah, do you want that purchase of this to happen because of this is happening in your body? I mean, we may get to that pretty soon where you don't have to really think about it. You've already kind of signed off that your medical practice or your whoever pharmacy is going to start sending you things as you need them. So very interesting.
Yeah, and we wanted to be different because we wanted to support the patients if they wanted to come to us in our ecosystem. But we realized not every patient wants telemedicine, and we think that's appropriate. We think that there's a good mix between patients who want telemedicine and patients who want in-person visits. And so, through our pharmacy, we wanted to support clinics who are doing in-person visits with a pharmacy that is NABP certified, that has the highest standards of quality in the products that we make, so that their patients are getting compounded medication that they can trust.
Wow, it's amazing. That's awesome. Well, just a couple more questions. I appreciate your time. I don't know how you have time to do anything else, but what are some of the things you do on a personal side? You mentioned lift weights. I think you mentioned you like video games. What kind of video games do you play, or what are some of the other things you do when you have some free time?
Oh yeah, I play pretty much everything. I play like role-playing games. I just finished Borderlands 4. Ghost of Yotai was really good.
I just saw an advertisement for that the other day. The Ghost one. Yeah, that was good.
It's good. It's good. If you like those if you played Ghost of Tsushima, you'll like this one. It's really good. I like taking walks with the family, with the dog, just the long lost family walk, on a Sunday evening or something like that. Me and my wife are big sports fans, so you'll usually find basketball or football on the TV. We like going to games. I used to be a Rocket season ticket holder before COVID. That's something I thoroughly enjoy. Audible. I don't like reading books because I'm weird about book texture. I don't like feeling the book, but I like listening to books. And so a lot of times when I walk the dog, I'll just pop in headphone, listen to some Audible when I'm walking the dog. And then, in the car as well, listening to some Audible. So I'm looking forward to fully autonomous cars. So we can do a lot of that stuff in the car.
Do some chilling in the car. Yeah.
Yeah. Just chill, do some work, maybe watch a Netflix or listen to a book. Right. So that's pretty much what I do in my spare time. And, despite like everything going on, I still prioritize my free time. And so my work day starts at 7 a.m., usually ends at 5 p.m. so I can spend time with the family. And I only do a few hours work on Saturday and I don't work on Sundays. So, I have this pretty balanced schedule of being able to work really hard, but also be present for my wife, for my son, and for my friends.
Very nice. How old's your son?
He is 8 months old almost. We got 5 more days until he'll be 8 months.
Awesome. Congratulations.
Thank you.
It's a good time. I remember it's some tired times, but it's a good time. It's a good time.
Yeah. We got blessed. He started sleeping through the night about 2 months in. So
awesome.
Yeah.
That's always a plus. Always a plus. So have you paid attention to the Rockets? What's happening now? I was able to go to one of the preseason games 2 weeks, maybe a week ago, and the potential lineup that they could put out there with 4 6'11" guys and Amen Thompson at the point guard is kind of crazy. I saw a thing come up on my social media that said, "Hey, remember the time?" I think it was back in 2020 when we had PJ Thompson as our center at 6'5", and now you got these 4 6'11" guys could play at one time. So should be fun.
Yeah, I'm excited about the Rockets this year. Obviously, KD, I went to University of Texas. I was in school when he was there. So I've been watching his career for a while. Reed Shepherd balled out last night. I don't know if you saw the season game.
I saw the highlights, yeah.
Yeah. Offense, defense, handle looked tight. He looked athletic. I like what I see from that kid. He should get significant minutes this year.
Yeah, I agree with that. Well, I have one question I ask everybody, and then I'll let you go, and that is when you're in a tough moment, when you're kind of things aren't going the way you want, what's the one thing you tell yourself to kind of keep that game day mindset, that prime time mindset?
Yeah, lean not on your own understanding, trust in God, because He put you in that position. He will deliver you through it. And that's worked for me every single time I do it. And when I don't do it, it doesn't work out for me. So that's been a focus this year, 42 years around the sun, really making sure that I'm turning to Him first before any major decisions or in any major moment, and just realize that you prayed for these moments. So there's going to be good, there's going to be bad that comes with it, but it's okay. He's got your back and He'll lead you through it.
And you can't have the growth without a little bit of struggle in there, right? Without a little bit of pressure causing that rock to turn to a diamond, or whatever your metaphor wants to be. So, Dr. Harris, I appreciate it. Is there a specific place people can find you, or any kind of social media you want to throw out there for folks?
Yeah, Instagram at drharrismd. And then my YouTube channel, I think it's just Dr. Richard Harris, MD. That's the best way to find all my archive videos and stuff like that. And then if you post a link in the show notes, I'll send it to you. It has a free ebook, 100-page ebook about all the lifestyle stuff. Don't need your email address. You just download a Google Drive, and like that spreadsheet I talked about. I really just made those to make a difference in the world. People told me I should monetize it. I don't want to. Like, this is things that can help save lives, and I feel like that's my purpose.
Awesome. Really appreciate your time. I really appreciate talking to you. Hopefully I'll see you when I get down to Austin one day soon, and we can hang out, or when you come to Houston, maybe we can go to a game together and cheer on these Rockets. So
yeah, I'm in Houston.
Great.
I live downtown.
Oh, you need to come to the clinic though. I thought you lived in Austin.
Yeah, our HQ's in Austin, right? I'm the only team member who's not in Austin, but I'm in Houston.
Okay, well then our clinic is right downtown. We're right just north of Dynamo Stadium. So we're right here in Edo, right down from Toot Sweet, little coffee shop. So
yeah, I used to live at 500 Crawford. I know exactly where Toot Sweet is.
Yeah, come check us out, man.
Sure.
So, all right, well I'll let you go. Thank you, Dr. Harris, and we talk to you soon. Everybody else, hope you have a wonderful day.